Hello, my name is Eric Wangsness, and I serve as President and CEO of Advent Health Wesley Chapel. I'd like to thank you for joining us today for our virtual event, No Family is Immune. In today's challenging times, where more than 1 in 7 individuals experience physical symptoms caused by stress, it's easy to see how situations involving our mental health can impact many of us. Although we are not able to meet in person, we want to continue to be a resource for those needing help. With the assistance of our community partners, we can continue to work to heal our communities. We hope you find this virtual event helpful.
Good evening, and welcome to this evening's virtual event, No Family is Immune. I am Ashley Howard and the chair for Advent Health Wesley Chapel's Substance Misuse Task Force. Our task force started as an outreach to better assist our patients suffering from substance misuse. After several years, we adjusted our approach to focus on both our patients within the hospital and community. Our mission is to develop a partnership with our community members and to focus on raising awareness and increasing access to resources for those suffering from misuse. The recent pandemic has created new challenges and barriers for those suffering from substance misuse. When our nation shut down last year, it resulted in lack of in-person support groups for recovery, a transition to being reliant on telehealth appointments for providers, lack of accountability for residents in drug court or those requiring drug testing, and an increase in the number of stressors added to our everyday life. Opioid-related overdoses have drastically increased in 2020, up 71% from 2019. Substance misuse is a serious public health issue. Our community is seeing an increase in use of illegal drugs and the inappropriate use of legal substances, alcohol and tobacco, all linking to increased risk for injury, premature death, association with our criminal justice system, and worsened mental health illnesses. Substance misuse can be prevented with community awareness, education, early intervention, and easy access to treatment and other supports. I hope that this evening's virtual event provides resources to all community members who may be suffering from misuse. Information and assistance will be provided to anyone in need throughout the program. Following this evening's discussion, we will be providing each of you with a toolkit with links and resources to recovery and support services. This evening's topic is very important, and I recognize that it may trigger feelings. If you need assistance or have questions for our panelists at any time during our discussion, please send us an email to wfd.communitybenefits@adventhealth.com, and we will reach out to our panelists for an answer and get back to you. Our first panelist this evening is Dr. Jonathan DeGroat. Dr. DeGroat is the Emergency Department Medical Director at Advent Health Wesley Chapel and Central Pasco Emergency Department. Dr. DeGroat obtained his undergraduate degree in mathematics from University of Florida and attended medical school at Jefferson Medical College in Philadelphia, Pennsylvania. He is a board-certified emergency medicine physician, fellow of both the American College of Emergency Physicians and American Academy of Emergency Medicine. He has practiced in Florida for nearly 10 years. Dr. DeGroat has performed medical ringside duties at amateur MMA matches and led a medical mission trip to Central America. He enjoys spending time outside the waters as well as participating in many different sports, including tennis and soccer with his wife and 2 sons. Dr. DeGroat joins us this evening to discuss cases related to substance misuse within Advent Health Wesley Chapel's emergency department and how to treat and care for patients of substance misuse while in the hospital. As mentioned earlier, since the beginning of the pandemic, our local emergency departments are seeing an increase in intentional misuse. Dr. DeGroat provides recommendations for patients newly prescribed opioids and how they can manage use and care, as well as how our community can assist in helping those who are suffering with misuse.
In the ER, we see the full spectrum of substance misuse, ranging from how it can affect one's chronic disease to the devastating outcomes of an overdose. There's a large component of mental illness, particularly as it pertains to anxiety and depression, with as many as 1 in 7 experiencing physical symptoms of stress, and they often cope through substance misuse. I also see in the ER how this affects everyone in the community. It doesn't discriminate. It affects everyone equally, from someone in search of their next home, to the next meal, to the successful businessmen and women at the peaks of their career, and also reaching into the healthcare and other professional fields. Unfortunately, we have seen an increase over the past year, partially due to the COVID-19 pandemic. Changes in substances have also become more apparent as restrictions on opioid prescriptions have increased. For example, there's been a rise in heroin, fentanyl, and certain amphetamines, while other prescriptions have become more difficult to obtain. Finally, evidence of increased COVID-19 contraction is seen in those with substance misuse, and then once they do contract COVID-19, often have a much worse outcome. Thanks again, and what questions can I answer for you?
Dr. DeGroat, talk about some of the cases you see in the emergency room when patients present with symptoms of substance misuse and how you're able to treat and care for them while in the hospital.
As I mentioned earlier, substance misuse can present in a variety of ways in the ER. Many patients can very successfully mask their substance misuse, and it's important to ask the right questions as this information is critical to properly treating the patient. Specifically speaking of presentations and cases, however, I think of this in 4 different ways. One is a medical illness that brings them to the ER. This can either be a chronic medical illness that has been affected by their substance misuse or a direct consequence of the substance itself. For example, in patients with hypertension and diabetes, it can often be difficult to control these chronic conditions in the setting of misuse, as the substance itself can directly interact with the medication, doses can be missed, or the substance can directly affect either the blood pressure or the glucose. Additionally, some substances can directly lead to medical conditions such as liver failure or pancreatitis. Second, withdrawal is often presenting to the ER. Many patients present after running out of medications or voluntarily trying to stop their substance misuse or being court mandated. We often see them a couple days into their withdrawal. This can be treated with fluids, electrolytes, medications, but does range from mild to life-threatening. Third, we see, unfortunately, a significant amount of overdoses. In the past year, we've seen a significant increase, almost 18% according to some studies, of the amount of overdoses in the United States. These can range again from mild to life-threatening, requiring immediate intervention. Oftentimes, in the very severe cases, reversal medications are needed, and we may even have to put someone on a breathing machine or life support. Finally, I think of substance abuse in the setting of severe mental illness disorders. Many patients will present, and these are intimately tied together. Often, by the time they reach the emergency department, they do require hospitalization for stabilization of the underlying mental illness, which is often anxiety, depression, schizophrenia, or a combination of these 3.
Are you seeing an increase in intentional misuse, and how do you think the pandemic has played a part in this as people try to cope with big changes such as quarantining and adapting to a new normal?
In short, the answer is yes. Particularly early in the pandemic, the healthcare system was under significant strain, specifically the mental health care system. This led to decreased access while everyone's anxiety and depression was increasing. We now know that the increase in anxiety and depression led to increased misuse of substances. There was roughly a 13% increase in patients newly beginning to misuse substances, as well as those increasing their substance misuse. This resulted in a significant amount of increased overdoses, which ultimately landed in the emergency room. As we go to the new normal, however, there's been a great rise in telehealth. This is particularly important in the mental health field, as many of these medications can be prescribed through a simple conversation over a computer or TV screen. I do believe that that'll be one bright spot moving out of the pandemic as it pertains to mental health illness and substance misuse.
What would you recommend to patients who are newly prescribed opioids, and what guidelines would you suggest to help manage use and care?
To start with, I think it's always important for everyone to consider opiate alternatives. There are many over-the-counter or alternative options to treat pain, such as ibuprofen, Tylenol, topical medications, heat, cold, and many other adjuncts. Some processes, however, are going to require at least a short period of pain medication. It's important to consider those after you've tried these other adjuncts. Once you've decided you do need a pain medication, it's important to use as few as possible for as few a days as possible. It's impossible to know if you may be susceptible after 3 days or 2 weeks to addiction and substance misuse, so it's important to keep it as short as possible. Finally, when you do complete the required number of pills to get through your acute painful episode, it's important to properly discard these medications. Unfortunately, they very commonly find their way into the wrong hands. This can be done through many pharmacies, hospitals, and there's even several FDA sites dedicated to which ones can be disposed of in the home, for example, down the sink or in the garbage.
How can we as a community assist you in helping these people before they get to you? And how do we work with community partners such as our esteemed panelists to make sure patients who come in with misuse issues get the right care at the right time?
Unfortunately, many patients get lost between visits, whether it's ER visits, urgent care, primary care doctor, mental health clinics. There's often a lack of handoff. At Advent Health, we're working to never discharge a patient. Similar to other disease processes, such as if you had an infected gallbladder, you'd be referred to a GI doc or a surgeon. Or if you were newly diagnosed with diabetes, we'd refer you to a primary care or an endocrinologist. This should be no different. If we recognize someone with substance abuse, we need to create the pathway to have the proper handoff so they can continue their evaluation and begin treatment potentially. As a community, I believe we need to ease and increase access to treatment centers. We also need to remove the stigma behind receiving treatment for this disease like we would in any other disease process. As an individual, what you can do is reach out to your loved ones, family, friends, and colleagues to see how they're doing. It's important to understand that the word fine can mean something different to everyone. It's individualized to that person and their experiences. It's important to dig a little bit deeper into how they're doing, particularly during these difficult times. If you do recognize someone who's struggling with the substance misuse, it's important to help guide them towards the right resources, which can often be found at your local hospital or health department. Finally, if you recognize someone with a specific opioid misuse, obtaining a naloxone medication may someday prove life-saving for them.
Thank you, Dr. DeGroat. We appreciate you taking time this evening to share with us firsthand how substance misuse affects you as emergency provider and our emergency department. We as a community can help in screening and offering assistance to those suffering with substance misuse. Remember, everyone's fine means something different, and it's important we continue to ask how our loved ones, friends, family, and colleagues are holding up during these difficult times. I would like to welcome our next panelist for the evening, Rod Cunningham, former DEA contractor for opioid misuse. Rod Cunningham is a 29-year retired Air Force veteran, speaker, transformational coach, author of several books on emotional wellness, community leader, and CEO of Chief Empowerment Network, LLC. Rod has developed numerous leadership, poverty reduction, opioid misuse prevention, and emotional wellness programs for the U.S. Air Force, DEA, Pinellas County Urban League and Job Corps, St. Pete Housing Authority, multiple youth programs, Pinellas and Hillsborough County Public Schools, positively affecting the lives of over 18,000 youth and adults. Additionally, he represented the Florida Coalition of Urban Leagues as he successfully testified at the Florida State Capitol in front of state legislator. He is married to Valerie Nicole. They have 3 children and 10 grandchildren. Rod joins us this evening to discuss how the presence of fentanyl or synthetic fentanyl has added to the tragedies of opioid misuse, statistics that surprised him most while working with the DEA, how schools assist with decreasing the number of at-risk students, and the effects of opioid misuse on our minority community. Rod, how has the presence of fentanyl or synthetic fentanyl added to the tragedies of opioid misuse?
So after I was brought into the DEA and began working with the community and really peeling back the onion, when I began to look at that, what I found is that drug dealers were cutting the heroin with fentanyl. And they were getting the fentanyl from overseas, and they call it a synthetic version of fentanyl. And if you take 1 grain of salt worth of fentanyl and you put it into the heroin, it makes the heroin 50 times more powerful. You take 2 grains of salt worth of fentanyl and you put it into that same heroin, it's now 100 times more powerful, and you get overdose and people die. That's what fentanyl has done to our community.
What were some statistics that surprised you the most while working with the DEA?
One of the most surprising statistics was that 200 people a day are dying from an overdose. When you take a look at that over a year's time, you're talking about 70,000 people, and they could actually fill a football stadium. So to lose a football stadium worth of people every year, That's powerful. That's a lot of people. That is an emergency for our nation.
How can the schools assist with decreasing the numbers of at-risk students?
When we take a look at schools and what schools can do, I think schools can assist by providing mental health training to parents as well as students, and giving the parents and students the tools necessary to create emotional strength.
What effects have you observed from the opioid crisis on minority communities, and what are some recommendations you would give to improve health equity amidst the opioid crisis?
Well, when I talk to minority communities, they seem to think that opioid is not a crisis in the community. They think that's something that's happening in other communities. What I found is about 9% of minorities are dying from overdoses of opioids. And so the 9% that are dying, the family members don't know that they're dying. The immediate family knows, but not the extended family. So they don't even know to pay attention. Why is that? When a person overdoses, the family members say they had a heart attack. And that's the story that they're going with. So others aren't even aware that their 25-year-old cousin died of an opioid overdose. They think he died of a heart attack. And so I think we need to really get that message out there properly, that it does affect all communities.
Thank you, Rod, for joining us this evening and providing us insight and increasing our knowledge about the tragedies of opioid misuse. As mentioned, it is extremely important to raise awareness within our minority communities. Many minority populations in the United States are facing challenges related to poverty, homelessness, and incarceration, which are contributing to an increase in substance misuse. Minorities face stereotypes influencing prevention and treatment. Many stereotypes affect where they decide to seek treatment and how they experience treatment. Increased community awareness will hopefully eliminate the stigma and stereotypes within minority communities to assist them with getting the message out that substance misuse affects all communities. Our next panelist this evening is Parnia Raghani with Florida Department of Health. Parnia graduated with her master's in public health from the University of South Florida in May 2020. She concentrated in behavioral health and obtained a certification in public health. Parnia has a strong passion in mental health, substance use, and health equity. She has worked with the Alliance for Substance Addiction Prevention, ASAP, on creating a culturally competent coalition and an anti-stigma campaign, #ChangeTheLanguage, which was created in her graduate program with her classmates. Parnia has since started the Cultural Competence Initiative and founded the Cultural Competence Committee with ASAP. Parnia currently works at the Department of Health, completing an Epidemic Intelligence Service Fellowship, which focuses on the opioid epidemic in Pasco County. In this position, Parnia hopes to combine her love of health equity and passion for behavioral health to fight the opioid epidemic in the community. Parnia joins us this evening to discuss opioid misuse data Pasco County Health Department is monitoring, trends they are seeing in Pasco County, and how the Department of Health is responding, and how we as a community can assist with combating substance misuse. Parnia, what data is Pasco County Health Department monitoring when it comes to opioid misuse?
So the health department uses a syndromic surveillance system called Essence. It looks at emergency department chief complaint visits, and it helps us identify any trends or outbreaks in the community and provide a faster public health response. I'm also assisting in analyzing the Pasco Sheriff's Office Behavioral Health Intervention Team, also called BHIT, their opioid overdose data, and seeing if there's been success rates since the implementation of the program and decrease in opioid overdoses.
What trends are you seeing in Pasco County, and how is the Department of Health responding?
So we've been seeing increased trends over the past few years. Pasco Sheriff's Office data has shown that we've seen the most opioid overdoses in 2020 since the beginning of the pandemic. The state of Florida Department of Health has hired 5 epidemic intelligence surveillance system fellows such as myself, focusing on the opioid epidemic and looking at it more of an epidemiological standpoint and trying to prevent any more opioid misuse. We've also also partnered with the Sheriff's Office, their behavioral health intervention team, in providing resources to those who have overdosed on opioids. The Sheriff's Office partners with local health systems in providing those resources. We've also partnered with the schools in hiring a school nurse to provide evidence-based curriculum to youth.
How can the community assist you in combating this epidemic?
So I work closely with the Alliance for Substance Addiction Prevention in Pasco County, also known as ASAP. We are a community coalition, and you can assist by joining our general monthly meetings, our general RX opioid subcommittee meetings. This epidemic has affected the community as a whole, so it's important that we hear your voices and your ideas to combat this epidemic. You can also help by talking about medication misuse in the homes with your youth. Let them know the dangers of medication misuse. We also provide timer caps, drug deactivation kits, and medication lockboxes to reduce any risk of medication misuse in the home.
Thank you, Parnia. I love hearing about the joint efforts Pasco County has established with ASAP, Pasco County Sheriff's Office, Behavioral Health Interventional Team, and within our school systems. As Parnia mentioned, it is important that we hear your voices and ideas to fight this epidemic. If you are interested in joining ASAP and the coalition to coordinate efforts to reduce risk factors for addiction, which helps to prevent and decrease substance misuse, go to empoweredcommunity.org and select Join a Coalition. Becoming a member is free and voluntary. As a member, you will have the opportunity to understand the change you desire, learn some about community issues, be creative, encourage use of drop boxes to safely discard medications, take part in campaigns, engage town hall meetings, attend general and/or committee meetings, promote awareness, and provide training and/or presentations. Our next panelist this evening is Dr. Rhonda Cameron with Premier Community Healthcare. Rhonda Cameron joined Premier Community Healthcare Group as a behavioral health counselor in 2001. Since joining the Premier Community Healthcare team, Dr. Cameron has evolved as a vital team member in multiple roles. As the Director of Behavioral Health Services and Executive Leader, Dr. Cameron is responsible for the strategic direction of behavioral health services, ensuring clinical performance measures are met. Dr. Cameron joins us this evening to discuss behavioral signs of someone struggling with opioid misuse, the stigma related to seeking treatment, recommendations she has for family members whose loved one is struggling with misuse, and how to connect to her services at Premier Community Healthcare. Dr. Cameron, what are some behavioral signs of someone dealing with opioid misuse?
Well, I'd like to share some information with you. There was a study from Michigan State University that polled 4,600 participants, and only 32% could identify folks with symptoms of opioid use disorder. And so it's very difficult to pick up on. And plus, there's motivation because of stigma for people to keep it more hidden. And so we have to be very careful in terms of looking for signs and symptoms. It's knowing your loved one. It's knowing their typical behaviors. It's knowing their habits and looking for big changes in terms of their habits. For example, signs that someone's misusing opioids, they have drowsiness, lack of energy, withdrawal from friends, foregoing their responsibilities, financial issues. All of a sudden, your loved one is shoplifting down at Walmart. Any major changes in sleeping and appetite, in their habits, in the people they're hanging with, can be signs of opioid misuse. And plus, they have a vested interest in really keeping it quiet. If someone's high in an opioid, they can have slow breathing, confusion, clumsiness, poor coordination, sudden nodding off at the dinner table or in front of the TV, and it's not simply being overtired, and constricted pupils. It's a very difficult judgment sometimes, which says a family member has to be alert and pay attention to something that could be very threatening information to the family.
What are some of the stigmas related to treatment?
There can be personal stigma. Someone who has bought into the image of moral weakness, being a bad person, being guilty about collateral damage that they've caused with their opioid addiction or their heroin addiction. And then there's societal stigma that these folks are low lives, they're not nice people, and it's every walk of life has folks with opioid addictions or other drug addictions. And then there's the stigma against medically assisted treatment. Because they're thinking, well, you're just trading one addiction for another. And medically assisted treatment is essential to, number one, keep the person alive. Number two, have them be responsible instead of stealing or doing other things on the street to support their habit. They have a regulated dose, a regulated amount of a medication with the ultimate goal, maybe in some cases, for people to be able to taper off the methadone or taper off the Suboxone to truly be stable in a new identity of being a non-opioid user.
What recommendations would you give to family members whose loved one is struggling with opioid misuse?
Well, a couple of things. In my job at Premier Community Healthcare Group, I do intake interviews with all adults coming into our behavioral health center. And what I found is that when I'm questioning folks, adults 18 and over, about their beginnings of their substance abuse, it's at age 10. It's at age 11, it's at age 12, 13. So if you focus early on the problem and pay attention early in the problem before it blows up and gets into a lifestyle, you're much better off as a family member. And it's tough things to deal with. And so to educate yourself about substance abuse, for example, one of the panelists talked about fentanyl. Folks don't understand that street marijuana is now laced with fentanyl, which is a major opioid. So it's not the marijuana from Woodstock. It's a very different drug that's out there on the streets that's being popularized. And people think it's benign. You know, with medical marijuana, it's sort of confused in the public mind think. And also be alert to dental work. A lot of my adult patients who became addicted at age 17 from narcotics given to them after wisdom tooth removal or a motor vehicle accident. And it took off from there because with substance abuse, you have a genetic substrate that accounts for 50% of the attraction to drugs or opioids or whatever. Another part is environmental and another part is personal. So you've got three factors is coming together in a perfect storm in substance abuse.
How can we connect someone to your services?
Okay, Premier Community Healthcare Group, we're located in Zephyr Hills, Florida. We do have a substance use disorder program, and we're expanding it. It's a 10-week program. We don't conduct detox. That's a medical event that needs to be closely monitored in a medical facility. Folks can call. Our phone number is 352-518-2000 to connect to our call center and secure an appointment with our behavioral health unit. We can treat substance use disorder as well as component mental health issues as well.
Thank you, Dr. Cameron, and thank you so much for providing more awareness to the signs of opioid misuse and what to look for if one of our loved one, family member, friend, or colleague is possibly struggling with misuse. It is important that our voices are heard to help end the stigma against misuse. More awareness results in reducing stigma and saving lives. Our priority as a community should be focused on allowing those struggling with misuse the space to heal without humiliation. I would like to provide you again the information to connect you to Premier Community Healthcare. Dr. Cameron can be reached at 352-518-2000. Again, 352-518-2000. You can also go online at premierhc.org. Our final panelist for the evening is Justin Frazier, recovery specialist. Justin has worked in the substance misuse mental health industry helping people find treatment for over 15 years. After spending years in the real estate industry while juggling a pain pill addiction, he decided to start a new life by receiving treatment for his addiction, which included finding a career he was more passionate about. Justin started working in admissions and expansion for a treatment center in Oklahoma that was later bought out. He then relocated after 7 years to Tampa, Florida. He ran admissions and discharges for a local detox for 6 years. He most recently worked for a Banyan Treatment Center. Justin joins us this evening to share with us his personal story combating substance misuse and his experience seeking treatment. He discusses barriers he faced in seeking treatment, along with his advice to someone wanting to seek treatment and to healthcare providers prescribing opioids to patients.
My name is Justin Frazier. I've been in the substance abuse and mental health field for over 15 years. My addiction started me in the mental health field. Like most people that are in this field, approximately 20 years ago, I was in my second year in college, had never smoked pot, seen drugs, heard about drugs. By the time I was in my second year in college, I had already rodeoed and played sports for a number of years from the time I was 12 until the time I was in college. I had accrued numerous injuries with knee injuries, elbow injuries, neck injuries, ended up getting spinal stenosis and 2 discs in my neck. Stayed off the pain medication, avoided that like the plague. I was trying to do everything from physical therapy to injections, cortisone shots, steroid shots, everything but the pain medication. Everybody told me, my dad's an ex-NHL hockey player. He advised me throughout the years on how to play on injuries and how injuries are magnets to other injuries. My coaches through the years always try to advise me not to take the meds. By the time, again, I was in my second year in college, I couldn't function. I wasn't able to dial the phone sometimes. I wasn't able to go out with my friends due to my injuries. And at the time, I was interning for a commercial real estate firm. And my business partner had actually played football for Penn State. He was an All-American. Little did I know, he was also on methadone due to sports injuries as well. And with medications and injuries, those conversations tend to come together with other people. And we were sharing stories before I knew it. That's when I really took a notice as to what type of medications I could really get. At the time, I was working what was known as a concierge doctor, somebody that would actually visit me on the golf course, do my medications. I could go get my medications. I could tell them exactly what I wanted, how much I needed, where I was. One example was I left my medications in my desk drawer on a Friday night. Got to experience withdrawal for the first time over the weekend. Never went back to the office over the weekend. Came in Monday sicker than a dog. Took the medications. An hour later, I felt good. Had never experienced that before. Told the doctor that on the next visit. My medications then doubled. Got to the point where, as in the commercial real estate business in the early 2000s, I saw the market was really struggling in the housing market. Knew I needed to get my life together. I had successfully got off drugs on numerous occasions. One time, 10 months was the longest I went, and it seemed like the people around me, family members, friends, coworkers, thought that I was actually on the drugs when I was off of them, but they thought I was clean when I was on them due to my injuries and aches and not having those when you're taking the medications. So, of course, that led to experimenting with other drugs. Never injected anything, but it doesn't make a difference nowadays. There's too many drugs out there that can affect you. Decided one day, I had a friend of mine who had gone to treatment. I kind of wrote the guy off as a loser. He lost everything. He lost his business due to cocaine and alcohol. I had nobody in my family, nobody at my church. I was doing Sunday school between services. I was doing the collection plate on the second service, and I was ushering on the first service. So I was a good person. I wasn't borrowing money. I wasn't taking money from anybody. I was burning bridges because my addiction was causing me to be very introverted. All I cared about was my meds and my work. Little did I know that my friend that I wrote off was the closest person I had, who I later ran into and was clean and sober. And he really helped me navigate the field because at the time, Google wasn't around. You could Yahoo so many different drug addiction words, and you would get multiple results each time. And really just going to the program that he went to was what made the difference to me. I had the 12-step I could go to, or I had a mind, body, spirit program that I could go to. And the mind, body, spirit program really made the most sense. A lot of my addictions started off with injuries. It just, most of their clientele that they dealt with had physical injuries that had started off with other addictions, but that seemed like the best program for me. It's worked for nearly 20 years. I had neck surgery 2 years ago, had some complications. I was actually able to take the meds as the doctor prescribed, walk off of them with no problems. Since then, again, been in the substance abuse, mental health for 15 plus years.
What has been your experience with seeking services, and what specific barriers did you have when seeking treatment?
So when I was looking for treatment, one of the biggest barriers, of course, was money. My folks didn't have the money. I had not spent everything, luckily. I had some 401ks that I had put investments in, and I basically liquidated what I had. At the time, there was either state-funded programs, there was maybe one or two in each state, or there was private programs. So I knew I wanted to go the private program route. Nowadays, it's a lot easier because insurance covers treatment. When I went, insurance was not covering substance abuse treatment. It didn't matter whether it started by an addiction or it started by an injury or an accident. Insurance wasn't covering treatment. One of the biggest things today that is so difficult helping people find treatment is there are so many treatment options out there. And Google can be very confusing when you're looking at treatment options. If there's anything I would recommend is call somebody that can help you navigate options that's not just jaded to the treatment center that they work for. Find a couple different options that's going to actually fall in and make sense to the person receiving the treatment. There's a ton of options. It can be quite confusing. I always recommend finding somebody like myself who can help you navigate those options. It makes it so much easier. These are places that I've referred dozens of clients to hundreds of clients in some cases. So I would certainly encourage you to look for a navigator, somebody who can help you navigate the area you're looking for treatment, whether the person needs to be out of the area, whether you want to have them close to home, what they're going to succeed at, what could be the topic that they could fail at in treatment. So all of those things are factors that need to come in together to actually give that person the right expectations so that they have a good treatment experience.
What advice would you give those suffering and combating substance misuse during the pandemic?
So a little over a year ago, we all experienced COVID-19, the pandemic. All of our lives changed. In the mental health field and substance abuse, we weren't sure what was going to happen. It ended up being our busiest time of the year from the first month on. Since then, it's been more busy than I've seen it in 15 years. During the pandemic, you're seeing more alcohol that's getting closer to checkout counters, more people that are drinking during the day, earlier times in the day. They're doing more Zoom meetings. They're doing more virtual, remote positions to where they don't have to be accountable. And they're able to get by with things like prescriptions and alcohol when normally they wouldn't be able to do that. During my experience during COVID, I decided to have foot surgery. It was one of those things that I always wanted to do. I had some broken bones that I needed to get surgery years prior. Decided to do it during COVID. One of the things that made me very successful at doing that was setting out a timeline with the doctor as far as how long I would be on the medication, and here's the last day I will take them, whether I have the pain or not. That was something that I had to be very clear with the doctor, and also not going in there every time and telling my pain level's a 10 out of a 10. Finding natural ways, heat, ice, things like that to help alleviate the pain, things like ibuprofen, anti-inflammatories, those helped a lot. But also having that timeline from start to finish when I would actually be on the last day of pain medication was what worked for me. Since then, I've felt great. I've added more exercise, added more vitamin and minerals to help with the deficiencies that pain medications cause. I can tell, though, for a lot of people, when I see people at restaurants, I see people drinking mixed drinks earlier in the day. I go out to do grocery shopping, and I see people with half a cart full of wine bottles and beer. So it is something that, all of our lives have changed. If anything I can recommend is contact a local therapist, a counselor, somebody that can help you with addiction and show you where your life has really changed from the start of the pandemic until now.
What advice would you give healthcare providers when they're prescribing opioids to patients?
So obviously people are going to get injured, they're going to have accidents. There's going to be times when somebody, whether they're an addict or not, is going to require pain medication. I would certainly advise, educate, set up a timeline, set up a time when you're willing to start that client on medications and when you're not willing to. A lot of doctors are moving to week. Some doctors are actually referring clients into pain management within a month after receiving treatment. So I would certainly educate the client, build out a timeline so that their expectations are set correctly, and also go over alternative methods to treat that pain once you're not willing to give them the medication. Also look for signs of addiction. Ask the person if they ever taken those medications before. Have they ever had any family members that have taken those medications? What type of knowledge do they have on those medications? Because a lot of times I hear people that are taking pain medications for the first time telling doctors they know what to expect when all they know is something that maybe happened to a family member. So with my experience on pain medications, one of the things that I wish my doctor would do that more doctors are doing today is educated me on how addicting these pills can be, educated me on what type of anxiety and what other symptoms and side effects these medications would have. I never knew what anxiety was until I got on pain medication. Next thing I know, I talked to my doctor, I'm on Xanax for the anxiety. So I wish the doctor had discussed more as to what these drugs would have done to my system, my injuries, what to expect. Again, we're going 20 years ago, so there's a lot more regulations in place. At the end of the day, I think the doctors buy the story. And you can look at a person's injury or accident and tell how severe it is in a lot of cases, but essentially the doctor is buying the person's story. So I would definitely ask the questions and really see what happened. Was a person intoxicated when they injured or hurt themselves? Were they around family members that were intoxicated? Is this an environment that a person should be taking narcotic level pain medication back home? So as far as my experience to clients today, I would certainly do more homework. There's tons of information online that tells very accurate information how these drugs can affect the system, how they can affect your metabolism. Talk to your doctor about the other medications, because that's the biggest thing we see with overdoses is the complication of multiple medications in a person's system. With the use of alcohol in a lot of cases. Let's not forget alcohol is one of the best pain medications that works extremely well that have been used for years. So when you're mixing alcohol, which we see a lot with the pain medication, I think those are things that the doctors need to go over more with the client because eventually the pain medication isn't going to handle 100% of the pain. Again, can't thank Advent Health for being so proactive with this last year during COVID-19, during the changes in everybody's life, and having us in here to do this panel discussion. It's been an enjoyable experience working with Advent Health and helping people get their lives back together. Enjoyed this evening.
Thank you, Justin, for sharing your personal story with the community, the panelists, and myself this evening. What an incredible story you shared and the journey you have experienced. Today, battling addiction is not easy, and COVID has added additional challenges to those suffering or have suffered with misuse. Thank you for speaking to the barriers to seeking treatment and how our community can navigate through these challenging times of the pandemic. Thank you, panelists, for this valuable information shared during this evening's No Family is Immune virtual event. We appreciate you joining us this evening, and I hope you will find the information provided tonight helpful. Although we could not answer your question during tonight's event, your questions are important to us. Please send us an email at wfd.communitybenefits@adventhealth.com, and we will get back to you. Thank you again, and good night.